Good afternoon, everyone. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health, based in Research Triangle Park, North Carolina. Welcome to this webinar session that highlights our organization's commitment to health equity and social justice. Today's session will focus on improving African immigrant health. It's part of an ongoing series, actually part 2 of a series that we have been coordinating with the Minority AIDS Coalition of New England, a Photovoice examining the impact of COVID-19 on African immigrants living in the New England region of the US. Again, welcome. In terms of background information, we want to share with you that African immigrants have been uniquely affected by the coronavirus crisis. Social, cultural, and systemic factors place African immigrants at greater risk of both acquiring coronavirus and experiencing severe symptoms or death related to COVID-19. However, to date, information is not being systematically collected and translated to support the real-time development of effective, culturally and linguistically appropriate COVID-19 interventions. Saudi is a Photovoice project conducted to document challenges experienced by African immigrants during the pandemic and capture effective coping and support mechanisms used by African immigrants living in the New England region of the US. This webinar will present recommendations for healthcare providers and researchers to improve African immigrants' engagement in COVID-19 prevention, treatment, and care. I'm excited today to have at least 3 panelists to join us today and presenters who will share with us really some exciting information about their work, their experiences, and even their discovery. Our first speaker is Chioma Naji. Chioma, I will acknowledge, is a CCPH board member and has been for a number of years. So we welcome her in her dual role as a board member, but also as Senior Program Director of the Multicultural AIDS Coalition in Boston, where she leads work in research, capacity building trainings, and community mobilization. Specifically, she founded and currently directs the Africans for Improved Access program, which is an HIV/STI outreach, screening, and navigation program engaging Black immigrants in Massachusetts. Her ongoing organizing with African immigrant communities has established her as a national voice and stakeholder advocating for the community and well-represented efforts in service delivery, research, and civic engagement. I want to acknowledge that Chioma is also currently a PhD student at the University of Boston School for Global Inclusion and Social Development, and is currently a fellow with the Robert Wood Johnson Foundation Culture of Health Leaders program. Our next speaker will be Agatha Odigwe. And Agatha is an African immigrant from Nigeria and a public health professional in the nonprofit space. Currently, she facilitates capacity building training and coordinates regional and national collaborative research projects on African immigrant health as program coordinator at the Multicultural AIDS Coalition in Boston. At this time, I will turn it over to our first speaker, Chioma Naji.
Hello, good afternoon, good morning, everyone. I do want to also acknowledge that we have a third speaker who will be joining us today, Inza Utara, who is the State Refugee Health Coordinator at the Office of Maine Refugee Services, Catholic Charities, Maine. So you will hear from all 3 of us today. We are excited to present this project. We're excited to be collaborating with CCPH, who has really started thinking about what does it mean to do community partnerships as it relates to immigrants, and has partnered with us to specifically focus on African immigrants. So we welcome everybody and look forward to the Q&A and discussion that will happen later on with our time together. So I will give a brief overview of our project, and then my colleague Agatha will give you a more details about our methodology and our analysis, and then my colleague Inza will let you know what our outcomes are. So again, my name is Chioma Naji. I'm a program director at the Multicultural AIDS Coalition. This project is funded by PCORI. And so we want to acknowledge that our award number is 17466-MAC. So some of you might be asking questions about who is PCORI. The PCORI stands for Patient-Centered Outcomes Research Institute. I want to take some time to talk a little bit about PCORI and what PCORI stands for, not only because they're our funder, but also because I know that this is a group that's committed to engaging community, engaging partners, and engaging community partners, community members, and other stakeholders. And I think that this is a viable funding source for individuals who are committed to that work, who are committed to building research literacy, particularly patient-centered research literacy in our communities. So PCORI focuses on ensuring that people are able to make informed health decisions that really benefit their overall health and improve their overall utilization of health services, clinical services. PCORI has basically about 5 focus areas, and these focus areas are also the areas in which they provide funding, right? And so they have an engagement portfolio, which they call their engagement awards. They have a portfolio around methodologies, a portfolio around research, and particularly research that focuses on comparative effectiveness research. Then they have a portfolio all around dissemination and implementation. And we were fortunate to be funded under their portfolio around engagement. And so their portfolio around engagement focuses on engaging patients, caregivers, and all other stakeholders in our entire research process, from topic generation to dissemination and implementation of results. And so I'm sure those of you who are with us today can draw the similarities between PCORI's focus around patient-centered outcomes and engagement with community-based participatory research or community engaged research, which is again why I think this is a viable funding source for people to look at. And here's a little bit more information about the Engagement Awards program framework. And so you'll see that the Engagement Awards has 3 program areas. 1 is capacity building, 2 is dissemination. If you remember, I said they have a focus on dissemination and really ensuring that the projects that have been funded through PCORI, the research, the evidence-based projects, that the findings are disseminated not only to service providers or healthcare providers, but also that they are tangible, friendly, documents that are developed so that patients can use them to make informed decisions. And then the last one is really focused on stakeholder convening support, right? So creating opportunities where you can convene different stakeholders, including patients, to engage in conversations around patient-centered outcomes research, or CER, which is their main way of research. So if you want more information, I saw someone put in the chat PCORI's website. Please go and find more information. CCPH is a resource to find information more about PCORI, and so utilize CCPH also. So now getting to our project. So our project is focused on or includes individuals from across the New England region. And so you'll see the partners on the slide. And I want to acknowledge that we really have a diverse group of partners. We have partners that represent community-based organizations that particularly provide services to refugees or immigrants, African immigrants. We have partners who are part of the resettlement, the state funded resettlement programming. And so they sit at the state agencies, ensuring that refugees are being integrated and resettled within our various communities. And then we also have academic partners, the University of Vermont. So we're even very excited about the way that we were able to put forth these various stakeholders that are working with our patient population, which is African immigrant health. And I want to acknowledge that one of the things about PCOR is they want to make sure that patients, who they call patients or who we call community members, are engaged in the process. And so that means being part of the leadership team. And that could be also advocacy organizations or other organizations that represent patients. In our partnership, we have three organizations that particularly represent our patient population, which is African immigrants. Next slide, please. So why are we doing this project? And Al pretty much gave a very good opening around why this project was critical for us to do. Our project is focused on the impact of COVID-19 on African immigrants living in New England. What we realized as all the information was coming out about COVID-19 is that the numbers happening within our African immigrant community were not being reported on. There were not conversations about the impact of COVID-19 on this community. And what we do know is that too often, what is happening in the African community is lumped under the racial category of Black/African Americans. And there are some similarities, of course, but there are differences that make it more important for us to really specifically focus on African immigrants. And so in our various states across New England, we knew that African immigrants were at greater risk around acquiring COVID-19 and experiencing symptoms, because one of the reasons is because our communities are the ones that you might see in frontline sort of jobs, right? Whether that is, within our hospital settings, or whether that's within our nursing homes as CNAs, or even within our cleaning, our janitorial staff. These are individuals who tend to be in frontline positions within our organizations and within our communities. Even in Boston, we have a lot of African immigrants and Black immigrants who are the ones driving our buses, right, and running our trains. And so really keeping in mind what are the high contact jobs, because those are the jobs that we know are going to be at higher risk. And then we also saw in our local communities that there was a lack of information around COVID-19 that is culturally and linguistically appropriate. And so when we talk about linguistically appropriate, we don't mean word for word translation. What we mean is even sort of concepts around that integrate the understandings of African immigrants as it relates to disease and health, right? And so how do we make sure that people are receiving information in a way in which they are traditionally or organically sharing and learning information? And then not just African immigrants, but across all immigrant communities, we know that there's a fear in accessing COVID-19 services, whether it's testing or vaccines or now the booster, because of the anti-immigration sentiment that has been happening throughout the US history, but particularly within the past administration and now with the current administration and what's happening on the borders with our Haitian immigrant brothers and sisters. And then lastly, what we saw was that there were a lot of mental health challenges that people were dealing with, because African immigrants tend to be a very communal community where they really base a lot of their interactions on their relationships with their families and their relationships with their communities. And so what we saw was that the inability to practice some of the cultural and religious practices had a huge mental impact on them, mental and emotional. And it was not just about not being able to connect with family, but was about not being able to be in spaces where they're able to continue to practice their cultural and religious beliefs. And we saw this as it relates to Eid, when Eid was happening. We saw this as it relates to when people were dying and there were traditional cultural ceremonies that happened and people were not able to gather and mourn together. Next slide, please. So now I'm going to turn it over to Agatha, who's our program coordinator.
Okay, hi everyone, thank you, Chioma. So I'll be taking us through the program's process as well as the results generated from the study. To implement this program, we had used different strategies ranging from our partnership development. During the course of our project, we partners in the states, decentralized or had decentralized power. This ensured that they were able to be flexible and adaptable to the situations that present in the states, because with the pandemic, different states had different guidelines and different mandates. So this helped us to be able to implement more flexibly the program activities. We also had a good team design, in the sense that instead of just working with just the partners, which had about one member on the team, we also recruited the help of community health workers from each of the states. Some states had more than one, in order to accommodate for like language needs and session times and availability. So with the help of the community health workers, we were able to stay in constant contact with our participants as they went into the field to take the photos. And then in case they also experienced or had any other problems or issues, they also had easy access to the community health workers who brought it to the leadership team. The team also had multiple training and support programs. Before the start of the project, we had received training on Photovoice using the Photovoice consultant. We had gotten training on facilitation and even conducting research, because for majority of our community health workers, this was their first time engaging in research, especially in Photovoice research. So that was really good. We had also, as a team, in conjunction with the community health workers, developed a workbook. So this workbook was used for the different sessions. We had 3 sessions of Photovoice, and each session had its own workbook, which laid out all the activities each session is supposed to have or is supposed to do. And because, as I said initially, this is a relatively new research methodology for most of our team members, we had also had continuous support and training in terms of having practice sessions, right? So before each session starts, we kind of meet together to go through the workbook, and then the facilitators, who are the community health workers, practice how to actually do those activities so that they get used to it and get more comfortable doing them. The session was also designed in such a way that it was able to be flexible to participants' needs. We had teams in states that had about 2 groups. This way, we were able to have a group that speak just a particular language, whether English, Swahili, Kenya, Rwandans, because those were our majority, or those were the majority of our participants. We had groups that were able to meet in person or online or hybrid. We saw this hybrid method pop up more during the second wave of the pandemic, when some states had to also shut down because of the increased numbers. So, for example, our team in Vermont had to move their in-person session because they had to. They had a hybrid, they had a virtual, and they had an in-person. But the in-person had to move virtual for the 3rd session because Vermont had shut down during the second wave of the pandemic. And so we saw that community health workers, in addition to the community-based organizations they were working with, had to now run around, get access to smartphones, laptops, tablets for their participants so they could complete their final Photovoice session. This also enabled us to provide interpretation services for these different groups. And then they had to do it at different times. Some states did theirs every week. Some states had a break in between, so they could also take more pictures and then come up. So this variety in structure also helped with the implementation of the Photovoice sessions. So what is Photovoice? Simply put, Photovoice is a participatory, which is the emphasis actually of this methodology, a participatory research method that individuals use to represent their experiences, their opinions, points of views using photos and narratives. Some people use videos, but anything that gives you both a visual and the written part of the experience. Our goal for this project had been to provide recommendations to researchers, providers, and healthcare systems in general for engaging African immigrants in COVID-19 intervention. And to do this, we had documented challenges African immigrants faced related to the COVID-19 pandemic, and also documented successful strategies that they had used to cope during that time. In order for participants to go into the field to take pictures, we had given them a few guidelines, right, to help keep them safe and to make sure that the pictures too they're taking are relevant to the objectives of the study. So as a team, we had come up with framing questions that we shared with participants so they could keep at the back of their mind as they took their photos or as they looked around their environment to decide what photos to take. The questions had included what was hard for you and or your family during the COVID-19 pandemic? What is your experience accessing COVID-19 testing and seeking care? What is your experience accessing other healthcare services during the pandemic? Where do you get your information about COVID-19, right? Because we wanted to know who their trusted source is as compared to the available source of information as well. And then how are you addressing or being supported through your challenges during the pandemic? So during the first session, we had collected basic demographic information about our participants. We found that majority of them are from the Democratic Republic of Congo. Majority of them were between ages 18 and 45. Over 75% of them were female. 60% of them are parents with an average of 4 children. 35% are refugees, 22% permanent residents, and 25% US citizens. And 25% of them had no formal education and weren't currently enrolled in school. They also reported experiences of COVID-19. So some of them or most of them reported having accessed COVID-19 services such as food assistance, unemployment benefits, COVID-19 testing, cash assistance, and rental assistance, and reported mental health impacts too, such as anger, depression, fear, and anxiety. So we saw that also 40% had tested positive for COVID-19, and 7% experienced symptoms, but they did not access care. 30% of them had also lost their jobs due to the pandemic. So in the end, the Photovoice session itself started between October and November. It was a 6-week project for those sessions. So we convened all 9 Photovoice groups across the New England region. All states completed the 3 Photovoice sessions successfully. Each state had at least 1 community health workers, but in total we had 9 because some states had 2 to accommodate for participants' needs. We had started with 118 participants thereabouts and ended up with 103 completing all 3 sessions. There were some dropouts along the way due to certain situations that we couldn't prevent. Each state had about 6 to 8 teams per category. Participants offered 44 recommendations for analysis. We had 57 photo stories at the end and 16 teams were identified. The teams include both the challenges and the strategies as well. We also held a town hall which had 73 attendees, and the attendees ranged from community members to other stakeholders, researchers, public health professionals, healthcare providers, different administrators or State Department officials. And in the end, we came up with 15 recommendations. So the themes for the challenges. Participants across all states reported feelings of loneliness and isolation, restrictive movement, life changes in the new normal, experiencing loss, whether financial or the deaths in family, friends, loved ones, system challenges, fear of the unknown, difficulties for children, and overall stress. For the strategies, teams identified were having hope and staying positive, adhering to government guidelines and assistance, exercising traditional home remedies, communications and information gathering, faith, and then maintaining connections to their friends, their families, and information as well. So we have all these photo stories on our website. Please feel free to take your time, look through the website and leave as much comments and feedback as you like, and we do respond to the feedback. But for now, we'll share with you a video, yes, of the photo stories so that it gives you an idea of all that the participants were able to do. Okay, it's taking its time to load.
Chioma and team, this is amazing. I wonder if we might take a moment to ask people to chat in the chat box, because people were so focused on the video. What words come to mind as you think about the images that you saw? We would love to hear from you. So you would take a moment to just in the chat box to share your thoughts and feelings, because I feel like this has, evoked so much powerful images of people. Kenya says it's powerful, more telling than I would have thought by the images. Another person says, amazing work. Roxanne talks about resilience. Others say, I'd love to share ideas with you about this work. Others, we'd love to hear from you. The word community, Comfort says the word community came up in her. Others? Thank you. We just wanted to give people a moment to kind of think about what they're feeling and share that in this virtual space. Inclusion, connecting to family and faith despite barriers. Angela says, hope. As an artist, it's so important to see. Another person says, as an artist, it's so important to see and feel people's lives and impact of COVID. Very powerful. Support and hope. Yes, thank you. Encourage and continue to do to share. Encouragement is another word that someone wants to share with us. Chioma, I'll also pass it over to you at this time, but I wanted to give way for that. Just so relatable, seeing yourself and your experiences in their photos. Thank you, Zion.
Thank you, Al, for creating that space to reflect. Sometimes we get so into the work and trying to get to how do we apply or think about our findings that we don't take time to sort of just pause and realize the impact that it has on us personally. And definitely the impact that it has on people that we love and care about. So I appreciate that.
Yeah,
and it reaffirms.
Think about like the images were so powerful, Chioma, that they can almost be traumatic for some people. And in this moment, it's hard for us to recall what was occurring a year ago. Yes.
Mm-hmm. And thank you for that. And I think it reaffirms the work that we need to do. I see a lot of folks on this call that I know and who are doing the work in their local communities with African immigrants. So for us to just be reaffirmed that what we're doing is needed and that we need to keep pushing the needle to make sure our communities are being cared for and are able to live well while they're here in the US. So I think next will be Enza, am I correct? Who will be sharing sort of what are our recommendations. And please, again, folks, take the opportunity to give us feedback, because this is living work, right? So it's not finalized, but we want folks' feedback. And Enza, if you can just take a moment to introduce yourself too. Thank you.
Okay. All right. Thank you very much, Chioma. I'm sorry for the few minute delay when I was trying to log in. For technical reason, I was late. And okay, but I believe I didn't miss a lot. So thank you very much for giving me the opportunity today to speak on our project. My name is Enza Ouattara, and I'm the State Refugee Health Coordinator from the state of Maine. I am one of the partners of the 6 New England states that conducted this project, this Photovoice project. And it was a pleasure for me to participate in this. It was an honor as well to participate in this project because it was touching a very particular population that we seem to ignore whenever we are working with immigrant population. So today I'm going to be talking about the recommendations that came out of this project. And when Agatha was doing her presentation, she said, we have had about 44 recommendations in total from all the 6 New England states. But then we have to group them in themes to come up with about 15 to 17. And I will tell you that we are still working on this recommendation. We are trying to finalize them. And they are very lengthy. And that explains probably the importance of the problems that the African immigrant have been facing with the COVID-19. Chioma mentioned a few of those when she was doing her introduction, the fact that they are occupying work positions that expose them more than other demographics, the fact that they live in larger families that, that contribute to exposing them more and in crowded quarters as well. So the 44 recommendation was shrinked and they were grouped as this image is showing. And we came up with at least 15 to 17 that I'm gonna go through. So one of the recommendation, one of the most important one, is to examine the use and importance of the traditional African remedies. Because during the research or during the project, many African immigrant community members talk about home remedies. And that is true. As an individual, from the African background as well, I personally know that we use a lot of biomedicine in Africa before migrating to the United States. And sometimes there are some illnesses or some disease that we experience here, and we strongly believe that, calling a family member from home to send us some, of the medicine that we've been used to treating those medicine will be helpful and better than even going to the emergency room or to see your primary care physician. So that came a lot. So for example, people talk about using ginger, lime, lemon, garlic, black seed. You've seen and some example in the photos that pass around. So we thought maybe examining that, and this recommendation probably go to some researchers, in the field to kind of look at that and see, what does those items used by African immigrant have, that help them, deal with the pandemic. Next. So another recommendation was leveraging the relationship with trusted African faith-based organizations. So we also discovered that, African immigrant, are all, their religion is critical in, the African immigrants' life. And most of them goes to churches and mosques. So we thought, and also most of them believe and they trust, their faith-based leaders. So we thought that maybe policymakers or healthcare providers or even government could probably use that avenue to access this population in trying to fight the pandemic among them. So that was another recommendation that was that came up a lot, because many of the people like to listen to their pastors. Even during the pandemic, when there was no way of going to church, people were still creating congregation, virtual congregation on WhatsApp and Facebook to still see their congregation member and talk to their pastors or their imams. Next. So establish a community-driven support system for youth. You could have seen that, most of the African immigrant parents, had, problems homeschooling their kids. And we thought, trying to create a community-driven support system around the African immigrant community members would help solve that problem, for example. So for example, we believe that to do that, one way to do that is to fund a local organization to conduct assessment with the African immigrant youth and respond comprehensively to problems that those category of African immigrant may face. So next. So other recommendations have been leveraging, we did that, commit to the inclusion of African immigrant in all aspects of research and healthcare system. There are a lot of models that are being used in the healthcare system that maybe African immigrants do not recognize with. So we believe that, trying to include some African immigrant in all aspects of healthcare research for the healthcare system will be also important here to consider. Promote culturally and linguistically appropriate approach to address mental health and emotional health. you could have seen in the data as well, in the data that Agatha presented, some of the participants reported mental health issues such as depression and anxieties. But unfortunately, we did not have, the power, or we did not prepare, to refer anybody for any mental health issue, even though we were, we came across people that reported that. So that just stayed like that. But we believe that states, organizations, healthcare system could promote some cultural and linguistic appropriate approach to dealing with mental health and emotional health during the pandemic. Okay, yeah. So integrate cultural practice into the healthcare system. That comes a lot. And implement comprehensive language access plan, including African dialects. Sometimes, people or healthcare providers, will think about interpretations, in the healthcare setting without thinking about the dialect. Sometimes you may come and somebody they will ask you about, some people were reporting that, you are being asked about your first language. And when you say French, for example, they wouldn't even think about if that depending on where you are coming from, the French you may be speaking may be different from somebody coming from Quebec, for example, or from Canada, for example, or from France. So they will just find somebody even on the phone that can speak French. But sometimes you said French, but you may not understand very well what people are saying. So considering dialect and considering the country of origin the person is coming from, to establish that interpretation connection, or to provide that resource, is very important. And creating a safe and healthy work environment. Some people didn't feel safe to even take a day out of work because they believe that if they take a day or two out of work, their boss may, fire them. And people were not aware of the fact that some organization and company were having federal government money to even allow employees to take 2 weeks paid leave as related to COVID. So they were not safe, they did not know what to do, and they kept going to work and getting exposed. So building research and health literacy of African immigrants, I believe that our work is a beginning to that, and I could see in the chat that some people are now getting interested in what we are doing. So that's very interesting. And identify and reduce area of financial threat for African immigrant families. Some people reported that, during this project that, sometimes help were in a form that was not quite appropriate to the need they were having. Some people were even bold to say that, well, we would have loved, the government to just give us the money and we will go ahead and get what we need to cope with the pandemic. So that's where this recommendation may be stemming from. And support infrastructure for self-sufficiency and community cohesion. These are all, policy and decision-making recommendations for states and organizations. And then the last but not the least was listen. So people didn't feel heard, especially in the state of Maine, where I'm coming from. Ethnic community-based organization saw this disproportionate impact on African immigrant coming, or African American in general. They saw this ethnic community-based organization in Maine, saw this coming earlier than the government, earlier than the Department of Health and Human Services. And they have been meeting at the earliest stage of the pandemic, finding solutions to help their communities before, and they were talking to the government about it, and they were not being listened because of the structure. The structure is such that the government cannot just provide, assistance or grant to small organizations that are not equipped to manage those grants. So they were not being listened, but they were doing their own thing to help their community members. And then later on, you all on this call may be aware that Maine was one of the worst states in terms of disproportionate impact of COVID on, on the minorities and BIPOC population. So listening to what the community members or organizations that are connected with the community directly are saying is very important. So I think that ends the recommendations that we are still working on, and that will conclude this project. Thank you for listening.
Thank you.
So we just want to reiterate that folks can, I see a couple of questions in the chat about access to this. So we will send out the recording. You will have access to this presentation. You can also go on our website, www.africanimmigrant.health.org. And the videos are available there. So the video of the Photovoice stories that we just saw, the actual images are on our website. And also you'll be able to get a glimpse of our town hall meeting. So what we briefly went over is that after we completed our project, we actually had a town hall meeting with stakeholders across the New England. And that was very fruitful in a lot of ways, where we thought we were going in to say, okay, we would like to get more a response from the challenges and strategies that we're presenting. But what we realized was that there's still a huge gap of knowledge around COVID-19. So a good part of that webinar at the end during our discussion was about educating our community members who joined us, our African community members who joined us, educating them about COVID-19. And I think that was an eye-opener for us in terms of the lack of information, or reiterated, I guess, our findings in terms of the lack of information that is out there. And again, it's not just like a word for word understanding, it's a concept understanding that I think that we lose, because we think that we can say, okay, how do you say about us in Luganda, right? Which is a language in Uganda, right? But really we need to think about what are we trying to relay to the community about about COVID-19, what we're talking about, but in general, what are we trying to relay and what is the best way to do that? Because it might not be a flyer or a pamphlet, it might actually be a video that we need to use. And so definitely go to our website and you'll be able to get access to all this. But after this, I think CCPH will be sending out this recording. And I will hand it back over to Al.
Hey, thank you so much. What a powerful experience we've had this today with listening to you and your sharing. And I think the images continue to resonate deeply with all of us. I have a lot of questions for you, and I know others have questions as well. I think that one of the things I really feel today, and so let me welcome you officially to the call. I had an opportunity to meet you. I guess it was last year. It seems so long ago now. And welcome to this. And so didn't want to overlook you, but we're just so glad to have you today. We were just kind of moving so fast that I didn't acknowledge you at the top of the call. One of the things that I sense from this today is this desire. People are asking about exchanging contact information and all of that. And I wonder, is that something, I'll direct this specifically to Chioma, that y'all have been thinking about, or about kind of creating this network, because there seems to be like almost a desire to have a clearinghouse, if you will, of resources and information. Can people find that on your website, or is that something that you all are actively engaged in?
Yeah, so there's a couple of things that I would say that align with that. Is one, on our website, we have started to curate or catalog articles that are specific to African immigrants from 2000, right, Agatha, to present. And so just for it to be a clearinghouse, we have, information, we have articles that have been published across all health issues. And so if you have an article that you have published and it's not on there, email it to us. We will definitely post it up there because again, this is a new community and there isn't much out there. So we created one space online in which we could at least start cataloging and collecting information that is out there. That's one thing. The other thing is that we talk about ourselves as a collaborative, the African Immigrant Health Collaborative. And the partnership has the ability to grow, right? And really think about how can we create, like you said, Al, a network of people, researchers, healthcare providers, community members who are really committed to doing work around African immigrant health. So we encourage you, please, to go ahead and sign up on our mailing list. We are thinking through what does it look like? What does it mean? There's opportunities for us to put together a gathering, a convening around that topic. And so if folks are really interested in that, please connect with us. And this is about us coming together and thinking about the best way to do it, right? It's not just this partnership, but us as a collective doing this work to really come together and think about how do we move this work forward.
I wonder also, you know, this work is so powerful and there's so much emotion in it. I wonder, and I just open this up to all of you all, you know, we're talking about individuals who have seen a lot and have experienced a lot in their lives. You know, some people having seen war firsthand and even pandemics in their country and similar kinds of health crises. How was this traumatizing for you, but also for some of the people that were participating in this work? And so were you feeling any of that, or did you hear some of that kind of being shared in the work that you all were doing?
Actually, as a team, as a team member, I did not quite participate, you know, didn't have the direct contact with the participant for a long period of time. I attended one session, you know, of the Zoom meeting that we're having, and during that session, some reported, you know, as I said, and as the data indicated, some reported some signs of, you know, mental health issues like isolation and loneliness and anxieties. They did not present it, but they reported it that that's how they felt. And so that's really happened. And personally, it was like a general feeling for me, because we all were, you know, since this thing started with the Zoom activities, personally, I believe maybe someone in this will identify with me. I had that feeling too at some point, you know, the Zoom effect, always home, always Zooming from home, you know, that loneliness, that isolation, that was a feeling that we had. And so it's like we were all impacted the same way, and the person reported it. And again, we didn't go deeper in asking questions, or we didn't probe to, you know, to have a lot of discussion. Yeah, at least here in Maine. I don't know if Agada, who participated in other session, you know, can give you more information.
Agatha, I see your hand up. Hear from you. Thank you, Edgar.
Yeah.
Thank you, Mr. Enza. Thank you, Al. So I just wanted to add to what Mr. Enza explained. So the community health workers had most of the interaction with the participants, but I was fortunate enough to attend some of those sessions in Vermont and in Rhode Island. And from your question, or for your question around the isolation and the loneliness, and I would really say it did, yeah, like it hit pretty hard. For some of the sessions I attended, you could see the emotions as people explained or talked about their experiences. One woman in particular, this was in Vermont, because they have this organization, this community-based organization that they are really close to. They go there for different services and not limited to just maybe things, social support. So they have the center helps them with like immigration services, interpretation, hospital appointments, like all of that. So the center had to close down, right, because of the pandemic. And you could see how she was just talking about how that has really affected her. that she couldn't come to even see people, just to come out and see people and talk to people. And that when she had the COVID-19, when she tested positive for COVID-19, nobody could come to visit her, which was really sad because it was just her and her family. Everybody felt like they were running away from them. It was like a stigma just saying that you have or testing positive for COVID-19. So she really felt really pained. And honestly, that really affected me as well, because you never really know how African immigrants live, right? Because they come from a place where everybody is together. I mean, to see your friend, you don't even have to make an appointment or call the person ahead of time. You just walk over to the person's house or go just visit the person without any form of prior notification. So having to just be alone with just you, and then you're sick and nobody can come to see you, it was really tough on them. So many of them felt affected by the loneliness and the isolation. Some of them even responded to how they were very happy we even created this forum, right? The forum gave them an opportunity to meet, even though it was online, at least they were still able to see other people in their community. They made new friends. They were talking about keeping up the sessions just so that they can be checking up on each other, and they're even using the opportunity to also talk about issues that are important to them too during the pandemic. So it was really it was a very moving session for all 3 sessions in all the states. And I really feel we should, as a community, both everyone attending the session right now and we that are still working on the project, to find a way to maintain that engagement that African community members feel, because that really helps them as they go through issues at their different levels. Thank you.
Yeah. Chioma?
No, I have to agree with what my colleagues were saying. And I want to emphasize what Agatha just said in terms of even creating this space was a relief, right? That people were excited to be a part of the project, but I would say, maybe even more excited just to have a space where they can talk to people. And we had groups that were very community specific, right? So we had groups that majority, if not all of the participants were from Sudan or Somalia, right? And so they were able to, speak in their own languages. They were able to laugh. They were able to talk about, how's your family doing? How's your daughter doing? How's your husband doing? And so we allowed for space for people to be in community before even getting in to sort of the research. And I think that supported the research being more authentic for our community, because we knew the importance of creating a space where people can just be with each other before we jump in, right? Majority of the leadership are African immigrants, are identified as first or second generation African immigrants. Even all of our community health workers are African immigrants. And so there was a familiarity there in terms of what is the best way to conduct this. I mean, once we do more with our recommendations, you'll see we use WhatsApp a lot, right? I think the go-to for researchers is just email, right? Not even text when we come to participants, but we use WhatsApp a lot as a way to communicate with our community health workers, as a way for our community health workers communicate with our participants. And so just, our team having that cultural knowledge was powerful to create a project where people just felt like they can just be and share and be vulnerable. I was a part of one where one person was really, to the point of emotionally like crying, right? Because of what they were going through. And so creating that space, allowing for that space to be a community space, I think was one of the most powerful. And even having this conversation actually is a reflection of that, because I did not think about that. But I really appreciate this conversation.
Yeah, I feel that because it sounds like the work that you did was very therapeutic for everyone that was engaged in it, right? It sustained, as Agatha talked about, this virtual community, and people were just happy to be part of it. I want to move on with other questions. People are asking questions around dissemination, in particular dissemination in non-traditional ways beyond kind of peer-reviewed products. What have you been thinking about that, and what are some of the ideas that have surfaced?
I think I would say that dissemination have already started, because we, like in the state of Maine, I had the opportunity to present this this project in several forums. Here in Maine, you have we have some district public health councils, you know, this, and where I was able to present this project at. And we also have the state refugee the state refugee coordinator and the state refugee health coordinator have forums like quarterly meetings and semi-annual meetings where I was able to talk about this project here. And also even recently, before coming to even this meeting, the Maine Public Health Association is planning a conference. I am not going to present this time, but I think the last one, when there was a meeting about the conference, they heard about this project. So I would say that, you know, from forums to forums, I think each state has been trying to have, you know, a way of disseminating this. And I think three of us were at a meeting for Rhode Island. Our partners in Rhode Island organized, you know, a conference where we were also able to present this. So these are the way for now that we are doing this, but I'm not sure if my colleagues have other ideas that we could probably disseminate this work.
Other ideas or thoughts about dissemination?
Well, we are in the current conversation around dissemination in other ways. One of the things that I've done in previous projects is use infographics as a way to report back to the community and as a way to create visibility and awareness and conversations used on social media or on WhatsApps, WhatsApp groups. Whatever. So I said it right before, but I think I'm tired now. And so being able to create user-friendly, readable materials is very critical, right? I know several people talked about how we're using this to do policy work, and I would love to have that conversation with a group of folks who are involved in policy work and really thinking about how do you make this type of information applicable. We do have a couple of recommendations that are policy-based, right? So we have recommendations around immigrant-friendly policies, definitely geared more towards ensuring that a lot of the relief assistance that has been put out it gives space for people with different immigrant statuses to be able to access, right? We saw that in Massachusetts and we saw that across New England, that people with certain immigrant statuses did not have access to some of the financial support. They might be in different housing situations, and so they are not able to get access to some of the rental relief work, right? And so those are some of the policy recommendations. And Angela, thank you for posting that. Would love to connect with you and just reach out to us, please. And so definitely really thinking about what are ways in which we can reach out to different stakeholders, just not researchers or providers, but policymakers. And I would love to hear people's ideas around that if people in this forum have some ideas around that.
I want to acknowledge Julie and the group of 15 staff at the New York City, I think that's Department of Health and Minority Health, are watching this webinar together. So hello and welcome from New York, and want to acknowledge them because they had a lot of thoughts and comments here, and sharing testimonies from the individuals, saying that thanks for sharing these awe-inspiring slides, referencing the photovoicing, the vignettes. They truly capture the emotions everyone felt during the pandemic, right? And I think that point is well taken, is that irrespective of where we come from, our country of origin, that people were feeling the same kind of experiences. So it really kind of like speaks to the humanity of so many people. And so I was thinking, when we've been talking about this work and really kind of contextualizing this, I remember when I first was in Boston with you all talking about the planning of this work, I was kind of struck by the number of African immigrants that live in the New England region. I wonder if if maybe you and Chioma could kind of talk a little bit about that. Here I am sitting in North Carolina, and I just wasn't aware of that. So I'd love for you to kind of give us a little bit of backstory about that to help contextualize that. And also the use of WhatsApp. That was not something that I was familiar with. But I'd love to hear from you about that. Please share.
Yeah. Yeah, I mean, if you see even in this project, if you go on our website, the part that Agatha presented, you will see the demographics data, where you will see that in the New England area, we have a lot of African immigrants from a lot of different African countries. We have people from Senegal, Liberia, Nigeria, Sierra Leone. We have also people from Congo. Congolese have been flocking in the most recent years as refugees and asylum seekers. In Maine, you have Angolan people from Angola. You have a lot of people from Congo that have been resettled as refugees here in Maine. You have people from Somalia, from Sudan, and also few people from Morocco and I would say the Maghreb part of Africa, where the white part of Africa. You have people from Morocco, few people from Egypt that I know here that lives here in Maine. So yes, New England is a white, region, but recently we have seen a lot of African immigrant coming to our shores. And yes, it wasn't difficult for me to reach out to the population because of the work I do. And also it was even easier when I included some community health workers from Sudan as well, from Sudan and Somalia, that help reach out to the population. We got people mostly from Congo, Djibouti, and Somalia here in the state of Maine. So I'm not sure about, and also people from Rwanda as well. That we got, because we have people that speak Swahili. We have to use interpreters and to help us and do that. So yes, when we're talking about this, one may think that New England is mostly white. How are we gonna get that? But yes, New England has been a destination for a lot of African immigrants recently, and we do find them in most of the states.
And just to expand on what Enzo was saying, I think there's a myth also around who are the individuals migrating, who are the African immigrants migrating. We do have a significant number of refugees, but the majority of African immigrants that migrate are actually of other statuses, right? They're migrating based on student statuses, fiance statuses, they're migrating for work. And I think that's just a general misconception around the narrative of immigrants, period. But particularly for African immigrants, understanding that folks are coming for work, right? Folks are coming for reasons. And even as refugees, folks are coming for reasons, right? Because they're not able to live stable lives in their home countries. And we can talk about the global political narrative around that, but I'm not going to go into that. And so we have people here who represent a very wide range, right? But when we think about this community, we definitely have to think about language, right, as a key component of diversity, and culture as a key component of diversity, and immigration status as a key component of diversity. And just because someone comes over who has a certain level of education, right, a certain level, with a master's or a PhD, doesn't mean they're not going to have challenges in the healthcare system. There's another study that I've done around health literacy in African immigrants, and what we found is African immigrants of high education level have low health literacy, meaning they have challenges accessing the healthcare system, using information that's provided to them to make informed decisions or navigate the healthcare system. So it's not even necessarily about education level, how smart we are, right? It's really about how broken the healthcare system is and supporting people with different languages, different cultures, different immigration statuses, and engaging and utilizing services.
Thank you. I mean, there are some comments in the chat box that really kind of highlight just that. I want to acknowledge Comfort. Comfort says, I want to connect with others who are doing research. Angela, thank you for placing your manuscript there and sharing that with us as well. And we have people from all over the US that are engaged in this work. One of the comments was like, you know, what do you feel at this moment, you know, around different states are responding kind of differently to immigration issues, right? And support for refugees. What more could be done, in your opinion, even just based on the feedback and the recommendations that you have around kind of being more welcoming and accommodating of individuals who are asylum seekers, who are immigrants, others?
And so I think it will be interesting to hear your thoughts around that, especially given where you sit in the state agency.
Yeah. Yeah, different states have different policy, or maybe have a level of a different level of African immigrant friendly attitude that may impact maybe resources that are available for the African immigrant, you know. Maybe this is where I would say organizations such as PCORI or anybody, you know, interested in African immigrant health or in African immigrant research should probably direct some of their resources to, being that they are like a national resource. So you're right. I mean, it's very difficult to access and to put resources at the African immigrant disposal when you are in an environment where this demographic is not really the priority of the policymakers. So, I mean, that's really difficult to address. But I believe that there are some private sources or private resources that people can probably use that metrics, you know, to see which state and which part of, you know, the country where we have this immigrant, and then the environment is not as friendly and as receptive of them, maybe to direct the resources in those areas. Yeah.
Thank you. As we wrap up today, I wonder, Chioma, if you would kind of provide some additional comments around PCORI and their interest in similar projects like this. You started out with that, and I was really impressed by it. I want to acknowledge that Community Campus Partnerships for Health has a Eugene Washington Community Patient Engagement Award as well, entitled At the Heart of the Matter, where we are conducting a series of virtual convenings with historically Black colleges and universities in the Southeast region of the US. And Chioma's opening comments made me think about how receptive actually PCORI has been to this project and similar ones that have really allowed us to work in new or different populations and communities and surface issues that really otherwise would not have even been addressed. And so, Chioma, I wonder if you have some additional comments about that around PCORI as a possible funding source for many of the individuals who are on this call today.
One, I want to say CCPH is a resource. So I'll let that out in terms of getting
CCPH is a resource, I said.
But I want to really encourage people to think about PCORI as a funding mechanism. They have their next funding cycle for engagement awards is in the spring. They actually have their process that you first have to submit a letter of intent. And then if you're invited, then you submit a full proposal. And actually a letter of intent is due Friday. Now, people who are okay with not sleeping for the next couple of days, go for it. Okay. But it also, requires you to really think about, again, having what they call patient partners. Okay. Patient, basically community members, those of us who do community participatory research, which I saw a lot of comments in the chat, basically means that you have community folks at the table, right? And community folks can be actual individuals, or it could be organizations that represent individuals. So advocacy organizations, ethnic-based organizations, like Enza mentioned. Some of our partners are refugee organizations. And so you want to make sure you have your leadership team reflective of and are inclusive of what they call patient partners. Okay. And then you want to make sure that you have an understanding of what PCORI is looking for. PCORI is interested in patient-centered outcomes or patient-centered research that supports patients in making informed decisions on their healthcare, right? Research that helps inform clinical interventions, all right? And so they have an amazing mechanism or amazing staff and team there as part of their engagement awards. So you can actually email them, schedule what they call, I think they call it like a discovery call, or you can schedule a call with them and discuss with them your idea for the project, right? And they will give you some insight on directions that you can go, all right? So there are mechanisms in which you can get more information about PCORI, like I said, CCPH, or you can go on PCORI's website, reach out to one of their project officers that's a part of the engagement awards, keywords, engagement awards, and ask for a meeting in preparation for submitting a letter of intent in the spring. Okay, I think.
Yeah. And Chioma, it's just that the operative word is engagement. That's what you want to focus on. This is not research. This is really about engagement. And so that's the point that we've really been trying to drive home is, who do you want to engage with? That group, those individuals, organizations need to be patients and need to include patients. They're part of the stakeholders, but there are other groups and what they call stakeholders that they're very much interested in as well. So please consider that as a funding option for you and your organization. I want to thank all of our panelists today for the work that you've done and for sharing personally and professionally with us. I think that an indication of a really excellent webinar is always how many people stay online. And we've been at it for almost an hour and a half, and people have stayed with us because it's been so powerful and it's been so impactful. And so many people continue to chat in about how excited they are. And I think many of them are just excited that the importance of being seen and the importance of being heard. And that's what this project really, to me, highlights is those two elements. Making the invisible visible. People are not invisible. They're very much there. They're just overlooked. And this project really has brought that to surface. So I think that's important. I want to encourage you to visit the website of ccphealth.org. We are a website on our website of resources, and we're a resource to you. Visit PCORI.org and also find out more about the African Immigrant Project by, I want to make sure I do that correctly, African Immigrant Health.org. Is that right? Yes, AfricanImmigrantHealth.org. Go there. Don't crash the system yet, but visit their website and find out more about them. Again, I want to thank all of our panelists and for you joining us. Give us a few days to place this on our website. And you can share this with others and have a watching party, right? That would be great. But share with Chioma how you're using this information. We want to know the difference that this is making in your life and in your professional work. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health, located in Research Triangle Park, North Carolina. Thank you for joining us and have a wonderful day.